Hello, everyone. Good evening. My name is Susan Reyna Guerrero, and I'm from Beacon Therapeutic. You are watching Live Can TV. It's a live call-in show. The number is 312-738-1060. I'd like to welcome everyone. For the next 30 minutes, you're going to be hearing about Beacon and one of our great programs, the FACT Project. Before I start and formally introduce our guest today, Kathy Daniher, I'd like to post some information about Beacon Therapeutic. We are located in the Beverly area. We have 4 different locations. One at 1912 West 103rd, that's our business office location. Our Longwood campus is 10650 South Longwood, and our elementary school is there, as well as our outpatient mental health clinic. Our Cal Park location is located on Ada in Calumet Park, and that is our high school location. And then our homeless outreach services is located on Western Avenue. A little bit of background about Beacon. We've been around since 1968. We were founded by a group of parents that were interested in finding special education services for their children. And since 1968, we've really evolved to a multi-service organization where we are today the largest provider of homeless mental health services within the city of Chicago. We're providing mobile mental health outreach services to homeless women and children in shelters, along with our therapeutic day school program. Today, I'm really happy to have Kathy Daniher here. She is from one of our newest programs, our FACT Project. And that was started a couple of years ago. But, I'd like Kathy to welcome you today. And maybe you can describe a little bit about your background and what brought you to Beacon and the FACT Project.
Sure. Like Susan said, my name is Kathy Daniher. I'm a licensed clinical professional counselor. And what brought me to Beacon is that I live in the neighborhood and grew up in the neighborhood. And so being in the neighborhood and knowing all the services that were provided out of Beacon as I was growing up, really, with this project coming up, it gave me the chance to come back to the neighborhood and give back to where I grew up. And so it was really nice to have that opportunity. Susan asked a little bit about my background. I have a bachelor's degree in psychology, and I have a master's degree in forensic psychology. I started out of grad school working as a caseworker, working with the homeless population and wards of the state that were homeless or at risk of homelessness as well. Providing services for them along in houses or out of shelters or wherever they were at. Some of them were single, some of them were also non-parenting, so most of them were 18 to 21, 22 years old. And after doing that for a while, I became the clinical coordinator of the agency and was coordinating services throughout all of the programs. So throughout the DCFS program, there was a shelter there, and also with the homeless youth that were in what we called TLPs and ILOs, with transitional living programs and independent living programs.
Yeah, and I think that's great because I think, clearly further reaffirms why it's such a great idea that you joined Beacon for this FACT Project. And maybe talk a little bit about what the FACT Project is, because I think that's something we're really excited about.
Sure. The FACT Project, well, first of all, FACT stands for Family Assertive Community Treatment, and it's based off of the ACT model, providing services to 18 to 25-year-old single moms who live in the Chicago area, and they all have to have at least one child under the age of 5, and they have to have an Access 1 diagnosis. They have to have they're either using substances now or have in the past. A lot of them have experienced domestic violence. They're either homeless or at risk of homelessness. We work with a lot of people who are in shelters, living on the streets, who are doubled up. And we get referrals from everywhere. And so what we do is we provide wraparound services for the moms. We have a team approach where it's a team of child parent therapists, substance use specialists, a housing specialist, a caseworker. And part of this project is for myself as the project director to actually go out into the field as well and to work with the participants. And we meet with them once a week, twice a week, 3 times a week, depending on the level of need that they have. And we house them and provide services for them and their children.
Now, one of the unique features of this initiative is that it's one demonstration project of 4 throughout the country, and it is something that's funded through the Conrad Hilton Foundation and other private funders, including McCormick and Polk. But clearly, it's a collaborative initiative, which has been really important. Who are some of the other collaborative partners within the initiative?
Beacon Therapeutic is the lead agency, and Heartland Alliance is the co-lead on the project. And we also work with Inner Voice and Voices for Children. And the unique thing about the team is that the housing specialist and the caseworker are actually Heartland Alliance staff, but they're housed out of Beacon and work as part of the team at Beacon Therapeutic, even though they're Heartland Alliance staff.
If you're just joining in, I'd like to remind you this is a live call-in show. If you have any questions or comments for myself or Kathy, please feel free to call. The number is 312-738-1060. And I'm here today with Kathy Daniher from Beacon Therapeutic. I'd like to put in our information again of where we're located. If you'd like more information on Beacon, please feel free to check out the website at www.beacontherapeutic-org. Kathy, during just a little bit ago, you mentioned Axis 1 diagnoses. Maybe describe a little bit about what you mean by that.
Sure. So Axis 1 diagnosis, our diagnosis that people are familiar with would be things like depression or PTSD, which is post-traumatic stress disorder, bipolar disorder. All those different sorts of things are Axis 1. They're mental health disorders.
And I know with this initiative, besides it being funded very creatively, as we talked about, there's mother outcomes, there's child outcomes, there's family outcomes, but there's also system outcomes. The intent is to change the way our society and our system works with homeless young mothers. Can you describe a little bit about the systems work that's done?
Sure. The systems work is there's actually a systems group that meets, and what we do is we have kind of through the project we've learned about what's working and what's not working for the participants, and so we've taken the things that are not working and as a whole group come up with some outcomes that we'd like to have by the end of the project. So for instance, there was a cross training between Early Head Start and the homeless providers. We just had another cross training between DCFS and the homeless service providers. So some of the systems work is trying to not only put in place services that are not working, but also to try and fix some of the gaps and the barriers that we're finding that a lot of the mothers that we're serving are having problems with when they're trying to provide services for themselves and for their children.
What other training? Because I think training is a crucial ingredient to the success of this project. So what are some of the other training opportunities that have occurred?
There's been a lot of training opportunities through this. We've been fortunate enough to have the majority of the team trained in a bunch of different things. We've been trained in motivational interviewing, harm reduction. A couple of us were fortunate enough to complete the 40-hour domestic violence training, child-parent psychotherapy, the Preventing Child Abuse and Neglect curriculum from 0 to 3. Those sorts of trainings are some of the things that we've been fortunate enough to be able to go through to, use those skills that we've learned to help with the participants and their children.
What the training sound like it's helped form the philosophy of care. Can you describe a little bit about the philosophy of care and the work? And I'm going to put some pictures up of the kids, which I think always kind of helps people understand who we're talking about.
Sure. The philosophy of care that we use is obviously it's a trauma-informed approach is what we first and foremost used. We also use harm reduction and a lot of other services that incorporate trauma and harm reduction. It's a strengths-based approach, so we work with the mother where she's at and the children where they're at. We don't force services upon the mother. This is a voluntary program, so anytime a mom is willing to work on something, that's what we work with her on. In the event that hopefully she would work on some of those things that she might not be willing to work on right away, that we would hope that she would want to work on, and the same thing with the children.
Why don't you describe some of the, how do we measure the effectiveness of, what's going on and is it making a difference?
Okay. Well, the project is fortunate enough to also have a local research partner out of the University of Illinois at Chicago. And so there's a program evaluation that's going on not only with them, but the Coordinating Center, which are 3 national entities that are overseeing the 4 projects. It's the National Center on Family Homelessness, the National Alliance to End Homelessness, and 0 to 3. And what we do is we have quarterly reports, and we report to those agencies every quarter. And then there's a research person that goes out from the University of Illinois at Chicago, and she meets with our participants on intake, and then she meets with them every 6 months after, and collects data.
Are there some outcomes that we can already say that we've found?
Well, we found that it works. We have a lot of stories that we could tell based off of the research as well. A lot of things that we could see happening at first, and now that we've been in this for over 2 years, the data is actually starting to show some of the things that we saw at first.
How about anecdotally? How about a few success, not naming names,
Sure,
but some success stories that you can possibly share?
Sure. Well, in general, I'd say probably about 75% of the moms, 6 months prior to working with the team, had tried to commit suicide. And since then, not one participant has tried to commit suicide or been hospitalized for suicidal ideation.
Significant.
No children have been removed permanently from DCFS. And we've had several intake cases that were actually closed because of the services that we were providing. We've had a couple cases where DCFS has actually been called, and because of the services that we were providing, the case was never opened.
Gosh, that's wonderful. And I think based on what we know of the impact of homelessness on children in terms of their development and the delays that can be expected, I do know that some of the assessment tools that we're using are showing that the children are either on track for their developmental growth or at least have not shown any regression.
Correct.
And again, significant for this population is that research does support that most children who are in unstable living situations or in a homeless situation do show those kinds of delays. Now, I think the biggest question is how much is all this costing? And is it cost effective or not? What would you say are some of the other systems that are impacted positively by the work that's being done in the FACT project?
Well, I think there's a lot of systems that are being impacted by the work that FACT's done. I've already talked about the Department of Children and Family Services. There's a lot of cases that have not been open or cases that have been closed due to the work that we're doing, already putting services in place for the mothers and the children. There's also the hospital system that's been affected. Like I said, the hospitalizations of the moms, they have not been hospitalized for any kind of suicidal ideation or intent. Also medically, a lot of the moms have medical issues. We also have a health educator that works out of Beacon, and although she's not part of the FACT team, she works collaboratively with us, and so she's able to go out and put services in place for a lot of the moms that have medical issues as well.
As you're talking, I'm going to put some more
Sure.
pictures of the kids up.
The homeless system, I think, we've had a great impact because we've been able to house a lot of the moms that have been, in the homeless system for years.
You mentioned working with the health educator within Beacon. What other programs within Beacon have you utilized?
I think that working with the population that we work with, we've been fortunate enough to be able to utilize a lot of Beacon's programs. Beacon has a LIOP program. It's a little intensive outpatient program where they work with young children, and the initiative calls for mothers, as I said, who have at least one child under the age of 5. So a lot of our younger children who have been showing signs of a developmental disorder or behavioral disorder have been able to utilize the school, and the school has been able to work with us to put services in place. There's also a program called CHIPRA at Beacon, and we've been able to utilize them to help make sure that the children that don't have insurance do have insurance. And then Beacon also has a program called SOS, which is the Shelter Outreach Services Program. And the mothers who are in the shelters, we get a lot of referrals from them, and we work very closely with them when they find moms who are more appropriate for our program that they refer, and we work really closely with them.
How do moms become a part of the FACT program?
There's a lot of ways that mothers have become involved with the
how long
FACT
do we have
program.
now?
A lot of the referrals come through SOS, as I stated before, the Shelter Outreach Services Program. A lot of referrals come through DCFS. Through shelters where SOS is not involved, there are some referrals that come through shelters as well. Now that we've been doing this for a while, there's a lot of referrals that are coming through churches that have started to hear about us. Hospitals make referrals to us.
Is there a waiting list?
There is a waiting list, but the waiting list, there's only 8 people on the waiting list right now. And as we've been in this program, the longer we've been in the program, it seems like the faster the turnaround time is for people who feel like they've reached self-sufficiency. And so we've done about 10 intakes in the past 3 months. And so the intakes have gotten a lot faster.
And how long do most moms participate in the program? How long do folks in the program?
We're finding about 18 to 24 months, depending on the mom and where she's at when she comes to us. But on average, it's about 18 to 24 months.
And how is the program funded? Is there a fee that the participants pay? Or?
There is no fee. There is no fee for the participants. The program is funded through the foundation, and the program is also funded, as you were talking about before, that we have a lot of grants. McCormick Foundation and Polk Brothers, and we're starting to bill Medicaid as well.
Yeah, and also the City of Chicago through their housing voucher program,
Correct.
so we're able to access that. I'd like to, if you're just tuning in, this is CAN TV. It's a live call-in show. If you have any questions or comments, please feel free to call. The number is 312-738 1060. My name is Susan Reyna, and I'm here with Kathy Daniher, and we're from Beacon Therapeutic, talking today about the FACT project. FACT stands for the Family Assertive Community Treatment Program, and essentially it's a collaborative, innovative approach of working with homeless young moms ages 18 to 25. Beacon Therapeutic is the lead on this initiative. Our partners are Heartland Healthcare. Inner Voice is also a partner. Voices for Illinois Children. I'm trying to. And so, what would you say are some of the biggest challenges that the FACT project faces, Kathy?
Wow, that's a great question. I think that some of the biggest challenges that we face are the mothers that we're working with. So many of them have had a history with DCFS or a history with, obviously, the shelter system where they have been forced to receive services that they don't want to receive. And so I think that our biggest struggle is getting them to trust us and getting them to understand that we're only going to provide the services that they want, and we're not going to force anything upon them that they're not ready for.
Well, and I mean, you touched previously on philosophy of care and talked about that. And you're describing almost respecting stages of change and understanding where folks are in this change process. How important is that in developing the model to work with young moms?
I think it's really important. I've found that, previously working for an agency that did work with wards and working with other entities that had, treatment goals and treatment plans that were pretty much based off of the client's needs, but also based on either reunification with a child or, things that they had to get done. It's a lot easier to meet them where they're at, and although you might not have success right away, success comes in larger quantities later on when you're able to just kind of stand back and meet the participant where they're at.
Where have some of our more successful moms gone on to?
Well, we've had a lot of success stories. One of our success stories, a mother actually went away to college and was able to get housed on campus with her son and to go to school and live in a family housing facility on site. And we were able to refer her and her son for services there. We have a lot of moms that were in shelter, and they've been stable in housing for a long time, and they're working, paying their own rent and providing for their children.
And I think that's really important. Where do some of the little kids go? Do they end up in daycare, preschool, or?
Yeah, I mean, most of the kids do. They end up in daycare or preschool and then go on to kindergarten. A lot of them we're able to help, get services put in place or IEPs in school if they need that.
And I know you describe 18 to 24 months that they're with the FACT program. If once they complete their program, can they come back again? I mean, do we keep in touch with them? What's some of the aftercare?
No, they do. We have one participant actually who decided that she wanted to move, and then when she moved, it wasn't as successful as she would hoped that it would have been, and came back, and we opened her back up. And that's only the only case. We've only had one case of somebody who was closed that really wanted to get opened back up. But we do keep in contact with them. We keep in contact to make sure that they're housing and that their children, that everything is stable for them. And so they do have an opportunity to get open back up if they want services.
I think one of the exciting pieces is the continuity for our moms and our kids. And I know your team, you've had very little turnover. Right. Which is kind of unheard of within this industry. So what would you say that keeps the rest of your staff or your team kind of motivated and going?
I think it's the success stories. I think it's that because we work as a team, it's nice to have somebody else to talk to or somebody else that can go in there and take over for a week when, things are kind of rough. It helps to have people who have different areas of expertise in different child parent stuff or housing or case management or substance use, because the team approach, being able to provide all those services for the participants, really helps kind of the one worker approach. You don't feel so much pressure because you have all those other resources right there with your team, and I think the team really enjoys that.
Describe a little bit about what the typical day looks like.
I don't think there is a typical day. The typical day, yeah. The typical day, it's just going out, meeting with participants. We schedule who we're going to see the following week, the week before, based on the need of the participant. So if the participant's in the housing process, they're most likely going to see the housing specialist. If they've regressed and or are using substances, they're probably going to see the substance use specialist. If they're wanting to put services in place for their children, they're probably going to see the parent-child specialists. Or if they just, we have certain workers who are therapists specifically for certain people. So they go out and see those people every week, and then we also alternate and see them for whatever other services they might need as well.
I know one of the specialties that are offered to our families is we offer child-parent psychotherapy as well as PCAN.
Correct.
Can you describe a little bit first about child-parent psychotherapy?
Sure. Child-parent psychotherapy is it's an approach that's been proven by Alicia Lieberman and Patricia Van Horn, and we were lucky enough to be in a collaborative this year at the Erickson Institute that was sponsored by the Irving Harris Foundation. And myself and another one of the clinicians that are on the FACT team were trained in child-parent psychotherapy. And what it is it's an approach that's used for the mother and the child, and it's a therapy based on trauma. And all of our parents have experienced trauma. And so it's about learning how to help the mom and the child talk about the trauma and about how the child can learn how to feel safe with the mom.
And it's a certain period of time, and it's very intensive work.
Yes, it's very intensive, once a week.
Yeah, and clearly the intent is that once you've gone through this, there's some working through with some of those trauma-related issues, and obviously the long-term impact is that the child is able to develop healthy relationships. There's a healthy relationship between the parent and the child, and it really improves overall the functioning of the family.
Absolutely.
Now, what about PCAN?
PCAN is also, like I said, one of the collaborating agencies is 0 to 3, and so myself and another therapist were lucky enough again to be trained in PCAN, which stands for Preventing Child Abuse and Neglect, and it's a curriculum out of 0 to 3, and it works. It's a large book, and it has all this information on it about the protective factors. And so there's things about temperament, and there's things about, brain development or healthy development and attachment. And so what you do is you go out and you use the information and provide the information to the mothers or the caregivers or whoever might be with the children, helping them understand kind of where their child is at.
And the FACT Project was one of the first specialists that were trained in PCAN in Illinois, if I'm correct, right? Or
myself and the worker were the first two people trained in the state of Illinois on the PCAN curriculum, yes.
And that's something that I think there's increased interest in having us train other folks in this model as well. And I think this is right in line with some of the things that DCFS is working in terms of protective factors. And can you describe quickly about the crosswalk that we're in the middle of doing with DCFS?
Sure, absolutely. So the protective factors that are in the PCAN curriculum are also the protective factors that DCFS is really looking at trying to work on how they can help put services in place for mothers and children before they actually terminate rights or before they take the children away. And so right now we're in the process of working on a crosswalk to show how the PCAN material and what we're doing really helps to incorporate some of the things that DCFS is also looking to do.
And again, this is part of the initiative of FACT, is to really make a systems change. And I think what you're describing is the things that we're doing that are making system changes overall, which is really exciting. I see we have a few minutes left, I believe. If there are any questions, please feel free to call. The number is 312-738-1060. I'm here with Kathy Daniher. My name is Susan Reyna. We're both from Beacon Therapeutic. Kathy, what would you say if somebody wants to help or somebody wants to be part of the work that Beacon is doing? How could they do that?
Well, they can call Beacon, and
and I'll put that information on.
They can call Beacon and always see what it is that they can do to help. But like I said, we work with a lot of moms where we're housing them, and so any kind of materials as far as anything housing, cleaning supplies, or we work with little kids, so cribs, beds, blankets, strollers, anything that you would think of that a normal family when they're moving into a new place with little ones would be very helpful. Any kind of volunteer work, especially around the holidays, donations for Christmas stuff right now, it's always welcome.
I'm going to put up some information on Beacon. Again, we will be here again next week, next Tuesday from 4:30 to 5. If you're more interested in finding out more information on Beacon, please feel free to look us up at www.beacon-therapeutic.org. I'd like to thank you, Kathy, for being on with us today.
Thank you.
We're talking about the FACT project. I'm not quite sure who's on next week, but somebody very interesting will be on as well. As Kathy quickly mentioned, it is the holiday season, so if folks are interested in becoming involved in the work that we do, please feel free to contact us. There's always opportunities for volunteers and for donations. Any final words or comments?
No, just thank you very much, and I'm very, very lucky and very happy to have been a part of this project with Beacon Therapeutic, and I really think that the impact that it's having on the mothers and the children, in the long run, it's going to make a big difference.
Yeah. Well, thank you. We've been around since '68, so I think we have been making a big difference. I'd like to think so. Thank you very much.